Yeah. Um, in 2014, the government decided to decentralize the provincial HIV response functions to the provincial governments and the provincial health authorities. When they did that, they also took away the funding that was given to us for the HIV prevention work in Papua New Guinea. So since 2014, we haven't got any development budget for the HIV response until this year. We have been given some money to do some work in the provinces. Otherwise, we haven't been given any funding like before. Government gave us funding, and then we gave those funds to the community groups in the provinces to do the HIV prevention awareness campaigns. And we had billboards, and we had radio messages, and we had TV and newspaper. Today you don't see that in the newspapers. There's hardly any awareness campaign because we don't have money to do that. So what we are doing is, because the government has given the money to the provinces, we're following the money to the provinces to help them set up HIV prevention programs in the provinces. So that's what we are doing now. It's been coming through the Department of Health, and we have statistics every year. We have new numbers come up, and we meet at the beginning of the year to do estimations on how many new infections have come, and that's through the clinics. The reports coming from the clinics give us numbers that we work with, and yeah, but this year we've had last year we had another increase in number of new cases. And this year we are expecting more because of last year's election period. Usually during the elections, people leave homes and they go out to be with their favorite candidates. And during that time, people are having sex outside of marriage or outside of their usual partnership. And we expect increase in number of cases that we see that in every election, that after the elections there's increased numbers. So we are expecting to do that. But if you're asking about statistics, right now we have about 60,000 people living with HIV.
That came through the NDOH?
That came through NDOH, yeah.
All right. And we go back to the workshop forum that we're having today.
Sure.
What's that challenge, and what do we want to,
Yeah. Ours is not really to do with the numbers, because NDOH collects those kind of information. Ours is to do with who is doing what kind of prevention work, or what are they doing in terms of HIV in the provinces. That's the report we want. And our job is to read those reports and find out what challenges they are having in doing those programs in the provinces. If they're having programs, then we go in and help them solve that problem, to see how best we can help them deliver the HIV prevention programs better in the provinces. When we have good HIV prevention programs going, then the transmission will be lower because people are listening to those messages and taking care and not having sex, or if they're having sex, they use condoms. When we empower our people with knowledge to have safe sex, then people don't get transmission. So the people on the ground who are doing prevention work are doing that kind of information sharing that, if you are going to have sex, use a condom, or stay with your faithful partner, that kind of information. And our job is also to make sure that there is HIV service in the province or in the district where people can go and get themselves tested. And if they are found to be positive, then they're put on treatment. So our job is also to make sure that that service is available.
Actually, last one, you were talking about this getting a patient at the focal point, or so you can just.
Okay. Yeah. When we had the provincial AIDS committees in the provinces, we had that committee reporting to us. Because the government decided to take that responsibility away from us, we don't have anybody. So what we are doing now is putting one focal person in each province, just one person who is working within the provincial health authority, and he reports to the provincial health authority, but he also reports to us. So whatever information or reports that needs to be given to us, this person collects them and then sends them to the provincial, to the AIDS Council. Yeah, so that is what we are doing. We've already signed one with Enga and one with West New Britain, and now we are working on 4 more with West Sepik, East Sepik, Western Province, and East New Britain. So hopefully we will sign those. And that focal person will be in the Provincial Health Authority to collect that information about the HIV prevention work and give it to us for us to analyze and see how best we can help the province in improving the HIV prevention in the province.